Welcome back. New York City's elderly population is facing a severe crisis marked by increasing poverty, insufficient retirement funds, and significant disparities across different neighborhoods and racial demographics. Senior poverty has dramatically risen by almost 41% in the last 10 years, with over 25% of older adults in the boroughs like the Bronx and Brooklyn experiencing financial hardship. Many seniors are compelled to work beyond retirement age due to financial necessity and the increasing cost of living. Joining us is the Editorial and Policy Director of Center for an Urban Future, Eli Dvorkin. Eli, thank you so much for joining us this morning.
Yeah, thanks for having me back on.
Absolutely. So to start things off, can you tell us what are the biggest factors driving the rise in poverty among older New Yorkers?
Sure. A big part of it is that the older adult population of New York is booming. Let's talk about the Bronx. The Bronx is still the youngest borough, but the older adult population has surged. The older adults are now 14% of all residents of the Bronx. That's up from 10.7% a decade ago. And overall, the older adult population has increased 32% in the Bronx over the past decade. There's nearly 200,000 Bronxites today who are over the age of 65. But that's not the only reason that the poverty rates are increasing. A big part of the challenge is that financial insecurity for older adults is growing. And what contributes to that, among other factors, are a shocking lack of access to retirement benefits, to Social Security, that's really making it difficult for older adults to age in place and age with dignity across the five boroughs.
Yeah, absolutely. And so we kind of touched on it in the intro and just now with the lack of retirement funds and the increased cost of living. But can you elaborate on why so many seniors are working well into their 70s and beyond? Now, we know that, 65 was around that age you start to look into retirement, or you are already retired at that age. But now that we're seeing such a drastic change now that seniors again in their 70s are working. So can you tell us a little bit about why that is?
Yeah, absolutely. A big part of the challenge is that older adults, across the five boroughs, but especially, in the Bronx, are experiencing these elevated rates of poverty, are struggling to be able to get by off of either very limited benefits like retirement savings or Social Security, or none at all. And just to give you a sense of the scope of the problem, the number of older adults living in poverty in the Bronx rose 53% over the past decade to almost 50,000 residents. The poverty rate in the Bronx for older adults is the highest of any county in New York State, about 1 in 4. For Hispanic older adults, it's 1 in 3. And by the way, that's one of the factors driving the increase, is that a growing share of older adults across the city and in the Bronx are Hispanic, are New Yorkers of color in general, and are immigrants. And all of those groups are seeing elevated rates of poverty, driven in no small part by lower rates of Social Security access and retirement savings. And when you see what that looks like in the Bronx, 2/3 of Bronxites over the age of 70 did not report any retirement income at all. That's the highest share anywhere in the state. Nearly a quarter, 23.6%, don't report any Social Security income. And obviously, that's the most important benefit that older adults generally in the United States have access to. So when you look at the financial insecurity that folks are facing, given the fact that so many folks don't have retirement savings, they don't have Social Security income coming in, they're pushed to work longer out of necessity. And we see that the number of older adults working in the Bronx has surged by even greater number, almost 58% increase in older adults working after the age of 65 in the Bronx compared to a decade ago. And in fact, over 13% of older adults are now employed in the Bronx today, compared to 11% a decade ago. So we see that out of necessity, in particular, a lot more older New Yorkers are having to work longer just to be able to get by.
That really is an unfortunate reality. Again, you're kind of decades ago, it was around this age that you would retire and you kind of looked forward to that. And so now to see that people are working well into their 70s is really unfortunate. So can you talk, you mentioned this a little bit, but can you talk about why such a high number of seniors lack Social Security or retirement income?
Yeah, there's a lot of factors at play there. One of them is that a significant portion, over half of all older adults in New York City right now, are immigrants. Many of those folks have struggled to access Social Security in their retirement years, in part because they never assembled the 40 quarters of earnings that they need to report to be able to be eligible for Social Security. Folks worked intermittently or potentially off the books for part of their careers, or folks who were caregivers, folks who were parents or caring for older adults themselves during their prime working years. they weren't, banking dollars towards Social Security. So that's a big contributor to the challenge. Retirement, is an even more astonishing share of New Yorkers who just don't have access to savings today. And in many cases, that's simply because folks felt like they couldn't afford to save when they were in their working years. They were scraping to get by. They were struggling to make rent every month. They were struggling with the bills. They weren't able to put away a little money every month into a retirement account. And as a result, we see that nearly two-thirds of older adults in the Bronx have no retirement savings to draw down once they turn 70.
Thank you for clarifying that. And now, would you say that this is why racial and ethnic disparities are also playing a role in senior poverty rates across the city?
Yeah, that's definitely a big contributing factor. I mean, certainly the earnings that you were able to obtain throughout a lifetime of work vary significantly. There's huge disparities there that fall along racial and socioeconomic lines. So if you weren't able to earn more money while you were in your prime working years, you most likely weren't able to save money for retirement. And unfortunately, we see some glaring gaps there. And you see those by borough. You certainly see some of the greatest disparities, here in the Bronx. But that's not the only factor. I mean, definitely when you look at some of the challenges that immigrants have faced in particular, assembling enough quarters that are eligible for Social Security to receive that benefit. And then there's some big challenges that women face in particular. Women who may have been primary caregivers for much of their working lives while also working, potentially a home-based, business or a side hustle or part-time work, who weren't able then to become eligible for Social Security after 65. So there's a lot of factors that contribute to those disparities, even just in terms of the economic issues. And of course, that's compounded by disparities in terms of access to quality, safe, and affordable housing and healthcare. Those challenges exist, of course, across all ages in New York. They just become especially acute as more of our New Yorkers age into their 65 plus years.
Absolutely. And I want to shift gears for a moment to talk a little bit about the report that we had mentioned. So, what does it reveal about the financial challenges specific to seniors in the Bronx?
Yeah, I mean, we do see the greatest rates of poverty among older adults in the Bronx. We see, really astonishing challenges around, access to Social Security and retirement, as we mentioned. We see, the growth of work, as we talked about briefly, and a significant increase in Bronx residents who are, I think, out of necessity, choosing to work longer. Those are kind of key factors in the Bronx. They're patterns that we see across the five boroughs. We just see them most pronounced in the Bronx. We see incredible demand for senior housing in the Bronx. A recent senior residence opened for housing applicants and received 26,000 applications for 84 units, and that's not atypical. That's pretty common when it comes to desperately seeking affordable housing, especially senior housing in the Bronx. So all these challenges are magnified in the Bronx, and in a borough that already deals with the highest poverty rates in New York City and the lowest median incomes. But I think in many ways, the poverty challenge that no one's talking about as much in New York City and in the Bronx is the older adult poverty challenge. And that's where we see the need to really focus policy and investment going forward.
Yeah, absolutely. Thank you for sharing that. And now let's talk about how the senior population in New York City has changed over the last decade, and maybe why is that leading to us to where we are now?
Yeah, sure. So, I mean, as I mentioned, our older adult population is not only larger than ever before, it's more diverse than ever before. We've seen, now that, over half of all older adults in New York are immigrants who were born outside the U.S. The growth in older adults, citywide is in particular among Hispanic older adults, Asian older adults. We know that the growth of those particular populations comes with some unique challenges, I would say, around cultural competency, linguistic diversity. I mean, we need to be able to offer services to older adults that meet them where they are, not only physically, but in terms of cultural background, in terms of languages, and as our older adult populations become more diverse than ever before, so too have the needs to invest in programs and services that are more themselves more diverse, more culturally competent, and linguistically competent. So that's one kind of key part of the challenge. What's shifted as that population has grown. I did also just want to underscore the huge untapped opportunities here as well. I mean, in some ways, older New Yorkers are one of our fastest growing natural resources. There's so much knowledge and wisdom that are contained within our older adult communities. We haven't done nearly enough to seize on the opportunity that our growing older adult population presents. I did mention the folks that are choosing to work out of necessity, but there's also lots of older New Yorkers more than ever before who are choosing to work out of choice because they want to stay involved and continue to work and contribute and find meaning in that. There are older adults who are, critically important contributors to their communities as volunteers and mentors, and increasingly as business owners. The number of older adults who are self-employed and who have started businesses has boomed over the past decade as well. So these are all factors that kind of illustrate what's changed about our older adult population, and none of that takes away from the really dire poverty challenge that the city's older adult communities are facing. But there's also some untapped opportunities there, and the city should be doing more to realize more of the potential within our older adult population.
Absolutely. And now we mentioned a lot of the challenges that they're facing at the moment, but tell us, how are they coping?
Well, I mean, it's challenging. A lot of older New Yorkers are turning to the same kind of social safety net programs that other New Yorkers experiencing poverty rely on. You see growing numbers of older New Yorkers in line for food pantries, picking up food once a week. You see it in terms of the data on the growth in demand for services, whether that's in-home healthcare services or home delivered meals, or help with making retrofits to apartments so that they can be more accessible as folks age, so that they can age in place, and certainly around demand for affordable senior housing. All these areas where there's just growing demand, and folks are coping in whatever ways they can. They're living doubled and tripled up with relatives where that's a possibility in multi-generational homes. Folks are seeking out other services through our senior centers and through other human services, nonprofit social services organizations. And I would say folks are helping each other out wherever they can, in informal networks, within communities, looking after, taking care of, keeping an eye out for our older neighbors. But it's a big challenge. And frankly, the investment just hasn't kept pace with the needs.
I was actually going to ask you next, what are the support systems in place and, that quote, village in place? And you did mention some of it. Please let us know if there are more, but also let us know what are the gaps and what needs to be filled.
Yeah, well, there's some big gaps. I mean, I would start with how the city invests in older adult services today. The city's main agency responsible for aging, the Department for the Aging, receives only a tiny fraction, less than half of 1% of the city's budget, even as older adults are now, almost, 1 in 5, 1 in 6 New Yorkers. So there's a big mismatch there. We're providing the key agency supporting healthy aging with less than 0.5% of the city's budget. That's got to change. There needs to be a commitment going forward from the next mayor, from future administrations, and from the state as well, to significantly ramp up investment in healthy aging. And I would go a step beyond that to say, look, there's specific categories of need where we see immense unmet need. Home delivered meals is a big one. Capital investment in our aging services infrastructure, including our senior centers, is woefully behind. We've got massive, multi-million dollar backlogs of state of good repair needs to make sure that those kinds of facilities, including senior centers, adult daycare centers, that those places are not only intact, but really livable, healthy environments. And we see some big unmet needs around navigation supports. A lot of older New Yorkers who are looking for help, they're struggling in part because we have so few resources in place to help those folks navigate the array of services that do exist today. We need, to invest more in navigation supports and individuals who can provide one-on-one support, counseling, and advising to older New Yorkers to help them navigate the challenges that they may be facing, the opportunities that are out there, and the resources or services that are available. But I think it starts with, one, investing in aging in New York in a much bigger way that meets the real scale of the need. And two, going beyond the Department for the Aging to integrate investments and policies that support aging in place, that support healthy aging across New York City government, from the Department of Transportation to the Department of Housing Preservation to the Parks Department. All of these agencies and many, many more have a role to play in cultivating a city in which we can age well and with dignity. They do those things in many cases in limited ways, with limited budget and also with limited focus and attention from top policymakers. But if we want to make sure that, as our older adult population booms and as older adult poverty grows, that we can meaningfully address those issues, we've got to not only fund the Department for the Aging, we've got to really invest in healthy aging across government.
Absolutely. You touched on a lot of the points that I was going to ask, including the Department of Aging restoring that funding, and also what are some policies and programs that need to be put in place. So thank you for sharing that. Now, I definitely do want to touch on What are the long-term consequences that could arise if this crisis isn't addressed?
Sure. Well, unfortunately, I think one of those consequences may be exacerbated in the very near future, and that would
Hmm.
be any reductions in the benefits in the programs that are funded by the federal government that older New Yorkers and that older adult serving organizations rely on. If we see a loss or reduction of any of that funding, whether that's funding for healthcare or meal services or transportation services or food assistance, we're looking at potentially an even more dire picture when it comes to meeting these growing needs. So we see the risks ahead potentially with a reduction in funding for an array of key safety net programs from the federal government, and the city and the state need to do more to prepare for that. Going forward, there's some pretty significant risks for our economy. I mean, we are going to continue to age significantly for the next decade. The growth that we've seen, in some ways, it's still just the beginning. The baby boomer generation is only now, for the most part, entering into those years, and we're going to continue to see the older adult population not only grow, but grow as a share of the city's overall population. And that means that there are fewer New Yorkers who are contributing to tax revenue to ensure that the city has the funds that it needs to provide these services, and more New Yorkers who are going to be in need of those services. That's a structural challenge for our economy, and it means that we've got to do a lot more right now to shore up the well-being of New Yorkers even earlier than 65, in their 50s, going into those years in the decade ahead, so that folks are able to be more financially secure, have some retirement savings, have a safe place to live where they can actually age in place, comfortably. We've got a lot of work to do, not only for our existing older adult population, but to improve the future facing our next wave of older adults. And unfortunately, we're going to see, potentially a more challenging environment to do all of that in if we see a reduction in federal funding.
Absolutely. Eli, thank you so much for sitting down with us today and sharing this with us.
Yeah, my pleasure. Thanks so much for having me on.
We have to take a quick break. We'll be back right after this.